Thank you, Harvey. I was also struck by one of the things that Harvey said about the value of the dialogue itself. Sitting in here and out in the hallways, talking and listening with some of you, I was struck that every group, every individual who's here represents some kind of a valid concern, and I think sincere and well-intended ones. And yet it's not the whole picture necessarily from every individual. So I think we're getting very valuable input as everybody tries to figure out what to do next. For example, I know some researchers, not necessarily the ones here, but elsewhere, who are really worried because, number one, they see good prospects for eventual clinical interventions that could be very powerful. And yet they know that there's a lot of basic biology yet to be done. So their fear is that something really bad is going to happen on the way that will shut everything down. And that is a legitimate concern, but it's only one of the many concerns that this community has to deal with, as Alta and Harvey just said. What was also encouraging is how many different viewpoints were presented today. And even though they may not be totally representative, I think they're excellent samples from physicians, from patients, from physician scientists who are somewhat different, from institutions, even governments, and even different nations and cultures, and from ethicists. Together, I think they have brought to the table really good questions and facts and goals and responsibilities, as I mentioned earlier. So as people try to figure out where to go next, I think this guidance from this discussion today and the dialogues that have started is really going to be valuable. Those early days of the HIV/AIDS thoughts and laboratory work leading, as it did, as Harvey said, to the development of some effective treatments, even though they're not ideal, they're still effective, and that they probably wouldn't have happened without those communities working together and listening. So I find it very encouraging. So as those of you develop plans for what you want to do and what you want your institutions to do in the future, I hope you'll stay in touch with everybody else in this group and others. Alta, would you like to close it out in any way?
I think at this point all I'm going to do is give people the permission to say thank you, applaud everybody, applaud yourselves, and good night.